Have a seat.
Watch your step, please.
Thank you.
All right, good afternoon, Doctor.
Afternoon, sir.
If I may.
Yes, please.
Thank you. Good afternoon. Could you please state and spell your name for the record?
Mark Joseph Tenarowitz, MarkJosephTenerowicz.
And what is your date of birth, sir?
2/28/69.
What do you do for a living?
I was an emergency physician. I'm currently not acting as an emergency physician.
Okay. What do you currently do?
I do disability review for the state of Rhode Island.
And so directing your attention back to January of 2023, were you an emergency room physician at that time?
Yes, I was.
And where did you work?
Beth Israel Deaconess Plymouth.
And could you briefly describe for the jurors your educational background and the training that you underwent to qualify to be an emergency room physician?
I did my undergraduate education at Trinity College. I did a one-year post-baccalaureate pre-medical program at Bryn Mawr College. I then got my medical degree from Brown University, and I did my residency in emergency medicine at UMass Memorial in Worcester.
And when you finished your education and training, did you work in emergency care after that point up until you changed positions?
I worked in emergency medicine from 1997 until May of 2025.
And directing your attention to January 24th, 2023, were you working in the evening hours that day?
I was.
And at some point in time, did you treat a child named Dawson Clancy?
Yes.
How did he arrive at the hospital?
He arrived by fire department ambulance.
And when he arrived, were you given a summary of his injuries by emergency personnel?
Yes.
What did you learn at that time?
I was told that he reportedly had been strangled and he was found without a pulse and not breathing.
And what observations did you make of Dawson yourself?
When he arrived, he had a breathing tube in. They had placed a device into the bone of his leg to give him intravenous fluids and medicines. CPR was in progress. He was not breathing on his own and he had no pulse and was not responding.
And did you observe any trauma to his body?
I believe there were some old appearing bruises on his legs and there was some ruptured blood vessels on his face.
And did you observe anything in the area of his neck?
Not that I can recall.
And what did you do to treat Dawson?
We continued CPR. We continued to give him IV fluids. We gave him doses of adrenaline to try and restart his heart. We confirmed that the breathing tube was in the right position. We eventually gave medicines to treat the presumed acid buildup in his blood. We gave him calcium to make sure that his heart would, if it started again, would beat effectively. And that's what we did.
And how did you go about making sure that the breathing apparatus was in place properly?
Basically 4 ways. We detected carbon dioxide in the air coming out of his lungs, which usually just comes from the lungs. I listened and could hear breath sounds. I looked with a video laryngoscope to confirm that the tube was between the vocal cords going into the lungs, and we did an x-ray.
And when you say you were hearing breath sounds, was that him breathing on his own or something else breathing for him?
That it was someone breathing for him, squeezing the bag attached to the breathing tube.
Okay. And so that the breath sounds you heard just confirmed that whoever was squeezing the bag valve mask, the air from that was going into the lungs and then carbon dioxide was coming out?
He was not breathing spontaneously.
Okay. And are you, while all of this is happening, are you continuing to assess him and his condition?
Yes.
And what were your assessments?
So we would stop periodically every several minutes to very briefly check to see if he was breathing on his own or if he had a pulse. And he was not at any point. At one point, towards the end of the resuscitation, I used an ultrasound to determine if his heart was beating effectively, and there was no evidence of that.
Okay. And based on your training and experience, at some point in time, did you make a determination that your efforts weren't going to be successful?
I did, based on the time from when resuscitative efforts started in the field by the paramedics and the time that we put in, and the fact that despite the best resuscitative efforts we could, the fluids, the medicines, the CPR, breathing for him, it did not look like his heart would ever start again.
Approximately how long did you and your team work on Dawson?
I believe we worked on Dawson about 40 minutes in addition to what the paramedics had done previously.
At any point in time, did you try to use a defibrillator?
I did not.
And why is that?
He was unfortunately never in a heart rhythm that would have made defibrillation an effective treatment.
So your heart has to be in a certain condition for a defibrillator to even work?
Yes, there are two heart rhythms, basically equivalent of the heart, that if you use a defibrillator, you can restore a rhythm that makes the heart beat effectively. He was never in one of those rhythms.
And at some point in time, did you declare Dawson deceased?
Yes.
Okay. And do you recall when that was?
I believe from my review of the records recently, it was at 1928.
In 1928, would that be 7:28 p.m.?
That's correct.
Thank you, doctor.
Mr. Reddington.
Good afternoon. You indicated that you observed what appeared to be older bruises to his legs, his lower
Yes.
legs, that like shin area? That area?
Yes.
And you also had an interosseous device, I think, is that what you said?
Yes, he did.
And that would require inserting a needle or something into the actual shin bone area?
Yes, into the tibia.
Thank you, sir. That's all I have.
All right. Anything further?
No, Your Honor.
All right. Thank you, Doctor.
Thank you.
I'm going to call Dr. Benjamin Kaufman.
Doctor.
Good afternoon. It's always said that the testimony you may have mentioned should be the court.
I do.
Thank you, sir. You may take a seat.
Watch your step, please.
All right. Good afternoon, Doctor.
Just for the record, Your Honor, I'd like to just note, same objection.
Same ruling.
Thank you, Your Honor. Good afternoon. Could you please state and spell your name for the record?
It's Benjamin Kaufman, Benjamin Kaufman,
And your date of birth, sir?
September 10th, 1984.
What do you do for a living?
I'm an emergency medicine doctor,
How long have you been doing that?
about 12 years.
Could you briefly describe for the jurors your educational and training background that qualifies you for that role?
Yeah, I went to Boston University for medical school and then Kings County for residency training and then Columbia for fellowship in global emergency medicine.
And where do you currently work?
Beth Israel in Plymouth.
And back in January of 2023, did you work there?
I did.
And specifically on January 24th, 2023, were you working that evening?
I was.
And while you were working that evening, did you treat a patient named Callan Clancy?
Yes, that was my patient.
And do you recall how he arrived at the hospital?
Yes, with the EMS, with CPR ongoing.
And is it typical that when EMS arrive with a patient, they give you kind of a summary or a rundown of the patient's condition?
It is.
And did they give you that rundown on Callan's condition?
They did. He, at the time, his heart had stopped and CPR was ongoing, and he was not breathing. He was receiving breaths by a bag valve mask ventilation.
And what did you do in terms of treating Callan?
So as soon as he came in, basically, we put in a breathing tube, and we were able to get an IV established. The first thing that we do is give a dose of epinephrine. And in this case, you can look directly at the heart with an ultrasound, and his heart started beating after we were able to give that dose. At that point, we continued compressions, continued giving him breaths through the breathing tube. And Plymouth Hospital does not have pediatrics or the ability to care for that level of pediatric patients. So we're on the phone with Boston Children's Hospital, making preparations basically to get him to the more definitive care.
And about how long into your care of Callan did he regain a heartbeat?
Probably from the time that he got to the ER, maybe like 10 minutes or so, I'm guessing.
At any point in time, did he regain the ability to breathe on his own while he was in your care?
No.
Did you do any examination or testing to determine Callan's brain function?
So At no point did he exhibit any brain function. I'm not like a neurologist, so we are not the definitive person, but in emergency medicine, there's a scale called the Glasgow Coma Scale, which is generally from 3 to 15. There's different variations for pediatrics, but he scored the lowest, which basically is you're in a coma or have no brain response during the entire time that he was in my care.
So on that scale, the 3 to 15, 15, would that be someone who's walking and talking and acting normally?
That's correct.
And a 3, is that someone with no brain function?
That is correct.
And you testified that Callan was at a 3 when you treated him?
At no time during his care did he have any brain function that was evident on my exam.
And at some point in time, was it decided to transfer his care to Boston Children's Hospital?
Yes, we were in contact with him basically immediately, and then he was flown by helicopter to Boston Children's Hospital, and the whole time the ICU doctors were on the phone reviewing the case and making recommendations.
And at any point in time, to your knowledge, from the time he entered the emergency department at Beth Israel Deaconess Plymouth until he arrived at Boston Children's Hospital, was he able to breathe on his own?
No.
Thank you, doctor.
All right, counsel.
I have no questions. Thank you, sir.
Thank you, doctor.